Welcome to West Pelvic Wellness. My name is Dr. Alyssa Easley. I'm our owner and founder. One of the top questions I get is, what is it like to have a pelvic floor assessment? And so I'm going to walk you through what a first visit is like with us. For starters, you're going to get new patient paperwork to fill out ahead of time. You're going to fill out some medical history and some pelvic floor health questions, and your therapist is going to get to review that before you come in, so that the day of, when you come for your initial evaluation, your therapist is already going to have in mind some talking points and some questions based on your answers in the forms. So after you discuss your history with your pelvic floor therapist, we will then get into your goals and why you want to come to pelvic PT and what results you want to get out of it. After that, we're going to move into our assessment. Now, I want to say everyone's assessment is going to be a little different depending on what we are trying to look at for your individual case. But in general, we are going to look at things like posture. So we will have you stand up and sit down and look at how your body is holding itself. We're going to check movement patterns. So your therapist may ask you to stand up and bend over or squat or do a lunge or even jump. This really is going to depend on what symptoms you're having and what we're trying to look at as far as your body's coordination patterns. We're also going to look at things like hip strength, hip flexibility. We may have you lay on the table to check your spine. We may look at your rib cage and your breathing patterns. We may even look at your knees and your ankles and feet, just depending on what you're coming in for. After this, your therapist may want to check your core strength and screen you for diastasis recti. Then we would likely proceed with the pelvic floor muscle assessment. And this exam probably takes like 5 to 10 minutes. It is more personal. So we will have you undress, and this is a digital, either vaginal or rectal exam. This test allows us to check the pelvic floor muscles in the different layers and compare the left side and the right side to really target where your pelvic floor is struggling the most, which is going to give us the right information to give you exercises to take home and work on these muscles coordinating better, moving better, getting stronger, being more flexible, or whatever goal we have. After your full body assessment, your therapist is going to explain the main findings of the evaluation and where we need to be targeting our treatment plan. They will also explain to you how many visits they think you will need over what amount of time. In that session, we're also going to go over any lifestyle or habit changes we want you to add at home to help your pelvic floor be more supported and less symptomatic. We're also going to take time in that session to do some of your homework exercises together so you know what you should be feeling and what they're going to look like when you take them home. Everyone's exercise plan, everyone's homework, everyone's PT care plan is different because no one walks in the door exactly the same. So you're getting a lot of individualized, not only assessment, but also items to take home to work on. After your initial evaluation, we will get started on your pelvic floor physical therapy plan of care. And this is the exciting part. This is where you get to see the changes in your body, see improvements in your symptoms, and have those goals be met towards lasting pelvic floor health.